Hi, this is Dr. Peters. I'm back answering your frequently asked questions about the services that we offer here in our clinic. So the next question that I get is, Dr. Peters, how do you help someone with peripheral neuropathy? So it's very important to understand that peripheral neuropathy has over 140 different causes and counting. And that can be from diabetes to thyroid disease to autoimmunity to chemotherapy-induced neuropathy to toxic reactions. So there's many different causes, but essentially when we say peripheral neuropathy, what we're really saying is nerve pathology or nerve damage. Now, usually in neuropathy, multiple or several nerves get affected, and it's usually not one nerve. Most people are familiar with carpal tunnel syndrome in the hand or in the wrist. That is called a mononeuropathy because that's just compression of one nerve in the wrist called the median nerve. But usually 80% of the time neuropathy is going to start in the lower extremity, maybe 20% of the time in the hands. Now, the first thing that we do is we want to look at the patient by doing a comprehensive exam. And this allows us to look at the different types of nerves that can cause peripheral neuropathy. There's two types of peripheral nerves. How many? Two types. There's what we call large fibers and there's small fibers. Large fibers are very thick, they're big, they have a lot of covering called myelin on them, and they're usually associated with balance or proprioception and muscle activity and muscle control. But the small fibers are usually the ones that cause pain or burning or stabbing or even numbness and tingling and sometimes even cramping. And this is the typical painful type of neuropathy. So there's really two types. There's positive symptoms, which is associated with pain, and there's negative symptoms that's associated with numbness. Now, most patients think that, well, Dr. Peters, I don't have pain, I just have numbness. That's okay. Well, more than likely, that's actually more dangerous. That person is sometimes at a greater risk of falling and, of course, a greater risk of amputation and losing their toes. When we do a comprehensive exam, we can measure both the large fibers and the small fibers, and we can grade that by using specific neurological instruments that test these types of nerves specifically. And we quantify that. It gives us a grade like A, B, C, D, E, or F. And that way we know how severe the neuropathy is. In the future, that serves as our baseline to know what we need, what we've done, and what we've accomplished in our treatment. Now, the purpose of our treatment is several-fold, but the first thing to understand is that in the spine, we have nerves down here in the low back. Usually, the nerves that get affected in neuropathy come out here between L4 and L5, L5 and S1, and those comprise the sciatic nerve that goes down the back of the leg, lateral leg, and bottom of the foot. In the neck or cervical spine, we have nerves here at C5 and C6, C6 and C7, and those nerves go into the shoulder and down the arm and into the hand. And when those nerves are affected, they can cause problems anywhere from the shoulder all the way out to the wrist, sometimes called carpal tunnel syndrome. So for us, it's important that we want to identify if that's the case, because we have a special treatment that we do in the office called non-surgical spinal decompression, and that allows us to open up that disc right there to take the pressure off of the nerves, and over time it allows those nerves to heal. Now, we also have to do proper stimulation and activation of the nerves to get them to heal. Most people know that nerves are electrical, so we use a very specialized, well-researched, proprietary electrical treatment called electronic signal treatment. And this has been shown in studies to reverse painful neuropathy and to regrow the nerves. With this treatment, there's no side effect. It doesn't cause pain. In fact, it produces what we call an analgesic effect. That analgesic effect is what's going to inhibit the pain and allow those pain signals to turn off. The stimulation aspect of what we're doing in our treatment actually allows the nerves to regrow over time. Now, there's another aspect to most neuropathies that most people, most doctors don't even consider or look at. And so here is a nerve, and this is a damaged nerve, and you can see that the nerve is shriveled, but each nerve has its own blood supply. So next to each nerve, there's a little artery or microcapillary that runs along the nerve. And the goal of that little blood vessel is to give oxygen to that nerve. Now, if something comes along over time and causes compression, or if it actually causes constriction of that area right there, then the nerve can no longer get the oxygen that it needs and it begins to die. This is actually what causes painful diabetic neuropathy, and sometimes it's even associated with restless leg syndrome. So in the office, we do special treatment with pulsed infrared light therapy. That's a form of infrared light. It's not visible light. And when we do that locally over the area that we're treating, it helps to open up the arteries, dilate those arteries, and get oxygen to the nerve, and allows those nerves to then become healthy nerves again. So when we stimulate the nerves, we increase nitric oxide, or we increase vasodilation. By doing that, we have a balanced system. Now, another important aspect of what we do is also called trigenics, where we do specific neurological myofascial techniques. If there's areas where the nerves can be trapped in the side of the leg or coming down the arm, we can de-entrap those nerves and take the pressure off of the nerves. So sometimes there's a compression happening that's causing the neuropathy, like in carpal tunnel syndrome, and we can alleviate that non-surgically without anything invasive, and it's actually quite painless. In fact, it reduces and eliminates the pain. The last aspect of our care is proper biomedical nutrition, and what I mean by that is, in what we do in treating patients with neuropathy, every person's requirement for nutrition is different. So we are able to determine by specific testing what your body needs, and by doing that, we can give your nerves in your body what it needs in order to heal, so that the nerves can come back even faster. That's a very, very important aspect when it comes to treating patients with diabetic neuropathy, even some medications and even chemotherapy, in order to get their body back into a healed state. So I hope that answered your questions. I look forward to meeting you and getting to know you. Thank you for watching this video.